My name is Chelsea Burdick. I'm the owner and clinical director at BURD Physical Therapy. So I've always had an idea in the back of my mind that I wanted to open my own physical therapy practice. In college, they really prepared us to, taking business classes and things like that to help prepare us if we wanted to go off on our own one day. I met my husband right after college, and he's my business guru. He was in sales at the time and believed that we could in fact open our own clinic one day, and he supported me in every way possible. So he definitely was that push that I needed to kind of go this direction. I've worked in a number of settings before. I've done home care, I've done skilled nursing, and I've done other outpatient clinics, and through those experiences I learned what I liked about certain facilities and what I didn't like. I knew the experience I had in college and also the actual work experience I had really was a solid base to start this clinic. The business side of things is what made me the most nervous. Adam has a lot of experience in that department, and he helps with our finances and things like that, and he always said to me, I'll get the patients on the phone, I'll get the patients in the door, your job is to keep them coming. So, I knew that with our business model and how we were treating in the clinic, people were going to like it here. People were going to keep coming, they're going to tell their friends about it, they're going to feel comfortable returning to physical therapy if they have another issue. If we successfully treated their shoulder, they're going to call us when their knee starts bothering them. So I was very confident with that. We run the clinic in a way that we would like people to feel at home and at ease when coming to physical therapy, and not like it's a stressor, not like they're going to be just experiencing pain when they come here. So I try to keep it that feeling of being at home and keeping a personal relationship with your patients so that they feel comfortable coming here. We use our diversifying factors and help in getting people in the door, and one of those things is treating people in that kind of personal one-on-one manner where we're giving them the attention they deserve, and again they feel comfortable coming in. So I knew as long as we got them in the door and they had their first experience here, they were going to enjoy it. I think the evaluation is really important with actually getting to know the person. We have a solid 1 hour time slot for our evaluations, and that doesn't include just seeing what their impairments are physically. We actually talk to them like a human being, and we spend a lot more time with patients than they would at the doctor's office, so we get to know our patients a lot better, and it really starts with that evaluation. Once we start treatment, that's when things can get a little bit more lax. We'll have them do exercise, but they can also communicate and talk to people in the clinic that are working with the other therapists. And that's when that camaraderie of being in physical therapy really begins. And if you walk in here on any given day, patients are going to be talking to each other, probably complaining a little bit to each other, maybe, feeding off of that a little bit, but you definitely see that kind of community engagement, and that's part of what makes people feel comfortable being here, because they feel like they can talk to not just us, but to the other patients as well, and everybody is just very friendly. And if we have a patient that might not want to talk so much to other patients, we do have a private treatment room, but most of the time people are out in the clinic, engaging with everybody else. So I think that helps them kind of get through the session if they're maybe in a little bit more pain or just not having a great day. I've had people come in in a very quiet mood, not feeling great, not wanting to talk much. By the end of the session, they're laughing, having fun, probably joking around with us a little bit about how much we torture them, but usually by the end of the day they're feeling better. So. My goal is to keep that kind of tight-knit, small clinic feel. So I don't want to turn into a large assembly line of physical therapists and trainers and things like that. So we are growing, and we have another full-time therapist here, and we're likely to continue growing. So I think we're probably going to be opening maybe another clinic, and again, keeping that small, kind of homey feel to it. And we don't want to feel like you're just another patient. So we want to, provide enough therapists and enough, time to give people the attention that they deserve in therapy. So I've had PT in the past. I've had good experiences. I've had bad experiences. So just being able to, and this is why I went into becoming a physical therapist. I've always wanted to help people, and the human body is what interests me. I want to, look at somebody and see what their impairment is, and help them to be the best functional, have the best functional ability as possible. Whether that's helping their pain or helping them, swing a golf club better, whatever it may be. People, this is your livelihood. This is your well-being. So if it's, pain that you're having, or, difficulty getting in and out of bed, whatever that may be, we're going to try to figure it out, and we're going to help that person. And everybody is so different. So that's why we take your goals into account and try to have you reach those goals as best as possible.